We are back at the University of Toledo Medical Center. We have Dr. Kelly Manahan with us. Thank you very much for your time from the OBGYN department. And we're going to talk today about something that people may not want to talk about, but the cancer division here and how you work with that. Give people an idea of what you do here and how needed your services are these days.
We provide GYN oncology services here, and what that means is women's cancer surgery and treatment. It's a very, very important service because GYN oncologists that care for women with these cancers actually can help the patient survive longer and better due to their subspecialty training.
Now, are there specific things you need to do when it comes to a man and to a woman that you specifically, are in the areas of women?
We deal with women's cancers of the pelvic organs like ovarian cancer, uterine cancer, cervical cancer that are specific to women. And those are things that we have received specific training for. We don't take care of other cancers like lymphomas or leukemias. Medical oncology doctors care for that. But GYN oncologists care for those female cancers, and they're trained specifically to care for them surgically and by giving chemotherapy. We say that we care for those patients from diagnosis to cure.
Okay, so are you seeing the number of GYN cancers rise, go down? What are you seeing?
In some organ systems, we are seeing those cancers rise. In terms of uterine cancer, that is a cancer that is the most common cancer that we see here in the United States, and that is actually related to the increase in obesity across the nation.
So they go hand in hand, and people may not realize that happens.
Correct. A lot of people don't realize that, but certain types of uterine cancer are directly related to the amount of obesity throughout the United States. Cervical cancer has been fairly steady or slightly decreasing in the United States. However, here in Toledo, we see a lot of cervical cancer, higher than in the surrounding Midwest areas.
Any reason why you see that so far?
One of our suspicions is that many times these cancers are found in women that haven't seen their doctors for 20 to 30 years. And so having a regular exam each year is very important to prevent these kinds of things being diagnosed.
Okay, so I guess that's a good tip for people to think about that. And I guess in your training and what you see every day, does that little bit of prevention maybe prevent it from becoming an even bigger problem down the line? Absolutely.
We see more advanced cases of cervical cancer here than I have seen in several other Midwest states in which I've practiced. So that little bit of going to see your doctor one time every year for just 15 minutes could save you from having a very advanced cancer diagnosis. The other cancer that we deal with and we feel is our daily battle is ovarian cancer. Ovarian cancer is something that we are not able to find early, but if we were able to find it early, the cure rate would be very, very high.
All right, Dr. Manahan, we appreciate your time. Thank you very much. From the University of Toledo Medical Center, and that is your Talk Back.